Joining us on the broadcast now is our correspondent Simon Marks. Thanks very much for speaking with us, Simon. I have to ask you for your assessment of whether the people on the ground and the authorities are, according to you, taking this crisis seriously enough.
I think it depends precisely where you go in the United States. You know, the American Medical Association 24 hours ago articulated the words that President Trump so far has not personally articulated. They want him to order a national lockdown here in the United States. And as you know, there are still a handful of states that are not locking people down, not telling people to shelter in place. And the American Medical Association said yesterday it's absolutely clear that the key to this is locking people down and controlling people's movements within their own, restricting it within their own homes. President Trump says he doesn't want to force that issue. He says that constitutionally and morally he is opposed to the idea of ordering the states, where governors traditionally oversee their own affairs, to take action. So in some parts of the country, there's no question that social distancing rules, face mask recommendations are being taken reasonably seriously by most people. In other parts of the country, there's no attempt to force those kind of restrictions on people. If you look, for example, at the state of Georgia, the governor there has just ordered the public beaches to open for the summer season, which the vast majority of healthcare professionals around the country think is absolutely crazy. If you look at what happened in Florida with the traditional annual spring break holiday just a few weeks ago, going ahead as usual, that clearly contributed to coronavirus cases all over the country. So it's still a very, very mixed picture.
400,000 cases and counting. Let's now talk about what the American president had to say about the issue of ventilators specifically. 110,000 ventilators, he said, coming over a short period of time. I don't think we will need them. In fact, he says they might be able to help other countries. But experts do not seem to agree with that.
No, they don't. President Trump, throughout this crisis, has suggested on a continuing basis that hospitals and some states are asking for more equipment than they need. Now, if you look at the situation in New York City, Mayor Bill de Blasio has said within the last 24 hours that at the moment the city is able to cope with the number of ventilators that it's got, that they don't need the additional tens of thousands of ventilators immediately to be shipped to the state. But the difficulty here that all the public health officials face, and the difficulty that hospital systems across the country are facing, is that it's very difficult for them to predict exactly which direction their various curves are going to go. So while you're seeing now in New York the number of new infections gradually slowing, New York still yesterday notched up a record number of deaths in one 24-hour period. Indeed, if you look at New York City right now, the death rate there has just surpassed 4,000 fatalities. There are other cities all over the country, Chicago, Los Angeles, Detroit, New Orleans in Louisiana, where they haven't yet experienced their peak of infection. So public health officials on the president's coronavirus task force are nowhere near as confident as he is that the country has enough ventilators. But he suggested yesterday that the UK had asked for 200 American ventilators to be shipped to the National Health Service in Britain, and that he was looking at fulfilling that request because he felt that the national stockpile here was sufficient to deal with America's needs.
Right, and in New York, the epicenter of the outbreak in the country, doubling of fines for breaking the social distancing norms from $500 to $1,000. Now, to what extent are the people on the ground actually following those restrictions?
Well, Governor Andrew Cuomo has been relentless about urging people to they just are not. He's been particularly critical of young New Yorkers, saying that he was closing the city's playgrounds in New York City because so many people were gathering for basketball. I took a walk over the weekend through Rock Creek Park, which stretches all the way from the outer suburbs of Washington, D.C., all the way down to the White House. And the park was filled with people and joggers. Not wearing face masks in accordance with the guidelines. So it's very, very difficult for authorities across the country and in New York really to enforce these lockdown measures. They are absolutely reliant on the common sense of individual members of the public, and that's one of the reasons why the American Medical Association, to go back to where we started, the President really needs to authorize a national lockdown, because this needs to come, they argue, from the White House. That if people aren't hearing it from the White House, if people are hearing, in fact, from President Trump that face mask use is entirely voluntary and he's not going to wear one, well, to some extent, there are people out there that take their cues from him. So these enforcement efforts are sparse and would of people to enforce not just in New York City but everywhere else as well.